Okay, so the first part of the skull, we did the superior view, the lateral view, and the inferior view, and the next part of or the second part, this will be the second video for the skull. ISO is ISO. The best way to see them is from this view, from the anterior view, and ISO is inferior, which is this one down here, the inferior orbital fissure. And the next one will be superior orbital fissure, which is the S. And the O will be the optic foramen here. So ISO, inferior orbital fissure. It's a fissure in the orbit. This is the orbit. This is the inferior of the orbit. This is the fissure, inferior orbital fissure. And this is another fissure that's superior. So superior orbital fissure. And the O is the optic foramen or optic canal. Also, if you're looking a little bit at the nose, you will see right here in the middle, this is the nasal septum, and the nasal septum is usually two parts. This is the bony part, and the cartilaginous part is gone. It decays after death. So this is the part here. The major part, all of this here, this is called the perpendicular plate of ethmoid. This part down here, this little part here, this is called the vomer. So perpendicular plate of ethmoid is the major part, and the vomer is this part. Both of them together will make the bony nasal septum. And actually, if you can look inside here, this is the inferior nasal concha. This is the middle nasal concha. The superior is more up here, so you don't see it from this view. So inferior nasal concha and the superior nasal concha. Now, if we opened the skull and look at it from inside, you will see three cavities here. This one in the front here, this is called the anterior cranial fossa. This one here is the middle cranial fossa, and this fossa down here, this is the posterior cranial fossa. Superior cranial or anterior cranial fossa, anterior, middle, and posterior. Anterior cranial fossa, actually, you will see these plates right here. It's not the best in this model, but it should be perforated, and this is what we call the cryptiform plate of ethmoid. And right here in the middle, this is called the cresta galli. Cresta galli means the rooster's horn, or cresta means crest or elevation like this, and galli means like rooster or something. So this part in the middle here is cresta galli. On either side of the cresta galli is the cryptiform plate of ethmoid. If you go down here, this is the middle one, and this is called, this looks like bad shape here. This will be the lesser wing of sphenoid. This bone is called the sphenoid bone. This is the lesser wing, and this large wing here, this will be the greater wing. So this is like a bat with two wings, lesser wing and greater wing. This part here, still in the middle cranial fossa, this will be the sella turcica, and the sella turcica is saddle horse. Sella turcica, saddle horse. This is the location of the Petwitcher gland, also known as hypophyseal gland. It should be located in this area right here. This bone, this large bone here, this is called the Petrus bone. So there are two foramina on the Petrus bone. This one here, which is located in the posterior cranial cavity. This would be the internal acoustic meatus, which is the other side of the external acoustic meatus that we talked about before. Here is the external, and here is the internal. So this is the internal acoustic or internal auditory meatus, and on the other side, this will be the carotid. So those two foramina are located on the Petrus bone. This one here on the Petrus bone from the posterior fossa, this will be the internal acoustic meatus or internal auditory meatus, and this one in the front here, which is in the middle cranial fossa, this will be the carotid. So here, if you look here at the posterior, there's this is called the internal occipital protuberance, which is the protuberance or the protrusion that is on the other side of the external occipital protuberance, and these are the superior and inferior nuchal lines. And that's it for the adult skull. Let's take a look real quick on the fetal skull. And the fetal skull, if you compare it to the adult skull, you see here, this is the coronal suture and this is the facial suture. At the meeting of these sutures, there is a point here that's in adults, it's closed, there is nothing really here, and another point here. And so if you look at the fetal skull here, you will see something different. You see here at this point, which is the intersection between the coronal suture and testicular suture, you will see an actual opening here. There is no bone here, just a membrane, to the extent that if you push it down like this, you can actually go to the inside fluids with CSF, and you can go to the brain actually, because this is just a membrane. It's not ossified yet, it's not bony tissue yet, and this is called the anterior fontanelle. And there's actually an extended part from the sagittal suture. So this is the first thing that's different in the fetal skull. The second thing is, if you look down here at the meeting of the sagittal to the lambdoid suture, there's another point here that have another fontanelle, that's a posterior fontanelle. So anterior fontanelle, posterior fontanelle. And if you look at the side here, you will see that at this point, this is the anterior lateral fontanelle, and this is a posterior lateral fontanelle down here. Same on the other side. Anterolateral and posterolateral fontanelles. So these are the differences. We have 6 fontanelles: anterior fontanelle, posterior fontanelle, one on either side, that's anterolateral fontanelle, which is at the meeting of coronal with the squamous, and here it is temporosphenoidal or temporosphenoidal suture. So at this point here, which is the pterion, this is the location of the anterolateral fontanelle. The other one here, which is location where the lambdoid will meet the squamous suture. So at this point here, you have the posterolateral, same on the other side. So the main difference is the 6 fontanelles, and that's it for the skull.